Exertus.
What's that?
Antidote. To what? The poison you just drank.
So I'm going to make this video as quickly as possible so no one gets lost in it. I was reading this article on one of my favorite news sites, the Duran, which was talking about how as we are singing, the trillions in bailouts are happening, and 26,229 doctors are infected in Italy because of not wearing correct masks during the protection. There's army protection. There are people being forced into quarantine, other people being forced to take care of other people in quarantine and becoming infected. And so Italy, which has a relatively small population, has supposedly as many infections, well, not as many, but many more per capita than in China. So this is kind of an interesting circumstance. And I thought we'd look in a little bit to the coronavirus because people keep talking about the Kung flu, and people wonder where you can get some good information. UAP was asking even where we can find a reliable source of information. Well, reliable, that's reliable is contestable always.
Every time a new patient is admitted to hospital, a new medical record is created. The medical record documents relevant information about the patient during their stay. It forms the legal record of care provided and is essential for clinical communication. When the patient is discharged, the medical record is sent to the hospital coders, who take the information and convert it into code. These codes are then used to identify trends and patterns of disease, improve the safety and quality of care, and to determine the cost of providing that care, so that the health services receive the appropriate funding. An incomplete or ambiguous medical record can lead to inaccurate coding. Due to strict coding rules, coders cannot make assumptions about diagnoses, procedures, medications, and complications. If the medical record is unclear, hospitals and their patients can miss out on the funding they're entitled to. If it isn't clearly written down, it didn't happen. To avoid this, clinicians should ensure that clinical notes are complete, legible, and updated in a timely manner, are as specific as possible, and use only commonly accepted abbreviations and terminology. Clearly document the principal diagnosis as well as any additional diagnoses, and identify all diagnostic and therapeutic interventions. Clinical notes should provide clear links between symptoms, medications, and treatments provided. In the case of complications, clearly documenting when the condition began, whether a complication was present on admission or arose during the episode of care. This will ensure that not only the next clinician, but coders, researchers and planners can take this information and use it to its full potential. Because a healthy medical record, clear, complete and coded, will not only improve outcomes for every Australian patient, but our healthcare system as well. The clearer the record, the brighter our future.
That can be debated or contested, but the Worldometer seems like a pretty decent site to start looking into information that you can then question. There are a lot of really interesting numbers here that have been put together into graphs and meters. They have all these programs that help make it easy to look at the official information. And again, the official information, for whatever it's worth, they're from these sources, and you can look them up yourself, like the World Health Organization, the Center for Disease Control, the Chinese government. There are a lot of these places that you might, take with a little grain of salt. But also interesting, Al Jazeera, particularly Dr. Majumdar and Dr. Mandel at Harvard, looked like they had some concrete data. The Russian news agency also. So there's There's some places where the information, and I would say if you haven't seen all of these sources, at least check them out. Granted, state agencies are inclined to manipulate information. However, cross-examining a number of different sources, you can probably find out the truth in between. As of last Monday, 205 cases of COVID were documented in Estonia and 93 in Russia. Now, people have been saying, is this real? Is this a real threat? Well, looking at the numbers, the idea of the consequences of a pandemic like this are still unclear. We're fast approaching the number of deaths experienced a few years ago by the swine flu. A flu which, by the way, did kill people in the United States in 2009, yet was contained. The issues with COVID-19 are it's a special virus that seems highly sociable, and the evidence points to the condition being transmitted not only through human touch, but seemingly through the air, despite the 1 meter social distancing rule. And there are even articles to suggest, and Worldometer even has articles keeps records about the numbers because they're constantly changing. But as the deaths are starting to roll in, a death in California, a man in his 60s, a death in Louisiana, a patient in his 60s, you start noticing that this isn't just affecting 70-year-olds, but anyone, and not just those with previous conditions, unless you consider already having been vaccinated with flu shots, a previous condition. When you see these underlying health conditions, you have to wonder what these health conditions might be. Seeing younger and younger cases also. There's 1,238 cases already in New York City, and a new case in Wisconsin. In La Crosse County, a man in his upper 20s. 2 confirmed cases. Symptoms for the 2 females in La Crosse County, in their 30s, included symptoms of fever, cough, body aches, and sore throat. More men are dying than women, and every day we're seeing new cases add up. Spain, 165 new deaths, and 2,626 new cases. Interesting number. But what you'll also start to notice is that around the world, almost nowhere is without cases. I mean, even to the extremes of these extremely small countries, Guam, Honduras, Cuba, Ethiopia, with even the islands, St. Barth, St. Martin, Virgin Islands, Sudan's got a few. One in the Cayman Islands. It seems pretty much everywhere. Togo, Montserrat, Vatican City, seems everywhere. Death rate by male and female, where's that? Males are getting infected more than women, and males are dying at twice the rate. The common pre-existing conditions have been cardiovascular disease, diabetes, chronic respiratory disease, hypertension, and cancer. Yet there's been at least a percentage of deaths that have occurred from people with no pre-existing conditions. Looking at the situation reports from the World Health Organization, they explain that the first case was diagnosed as a case of pneumonia on New Year's Eve in Wuhan City. From New Year's till January 3rd, a total of 44 case patients with pneumonia of unknown etiologies were reported to WHO by the national authorities in China. The Chinese authorities identified a new type of coronavirus, which was isolated on January 7th, 2020. Now here's an example of something you can question about the data. On February 13th, the number of cases spiked to a growth factor of 6.95. I mean, seriously likely that they were underdiagnosing, and at one point something had to give when people started melting. And it seems pretty likely that the first few cases were witnessed in China, and the growth has considerably climbed since then. The CDC has regularly updated information about the cases. Now, take everything the CDC says with a grain of salt, but this link mentions that there are a number of other public health laboratories that are testing outside of the range of the CDC. One of those being, of course, the Public Health Department.
The Corps, as you may have already heard, is one of the best kept secrets of the United States. Hardly anybody knows who they are.
Outbreak. Thanks to Hollywood blockbusters, that word can send a shiver down anyone's spine. Most of us would think of diseases like Ebola and cholera in other parts of the world. But in fact, the United States often experiences outbreaks of potentially fatal diseases. What prevents such outbreaks from becoming contagions like we see in the movies? One major reason is a little-known government institution called the U.S. Public Health Service Commissioned Corps. One of the 7 uniformed federal services, the PHS Commissioned Corps, is made up of 6,500 health and medical professionals embedded throughout nearly all government agencies, working on a daily basis to prevent the outbreak and spread of disease, and who can be deployed on short notice during a natural or man-made disaster or disease outbreak. Headed by the Surgeon General, they are a critical force responsible for protecting the health and safety of U.S. citizens.
The mission of the Public Health Service Commissioned Corps is to promote and protect and advance the public health of the United States. But that is a very narrow definition which doesn't do justice to the very broad and diverse mission and range of responsibilities that these officers have. They serve throughout the United States government in 28 different agencies and positions around the world. They fulfill a very important role that addresses the many diverse issues of public health with the expertise that they bring.
The PHS Commissioned Corps works with nearly all government agencies like the FDA, CDC, EPA, and FEMA, even the Department of Defense, on a daily basis to protect citizens from foodborne illnesses, infectious and chronic diseases, and environmental disasters. Like the National Guard, this elite team descends on the site of affected areas, providing health care and preventing the spread of disease. They are also deployed overseas to assist underserved nations facing health crises and work with legislators to create policies to better protect and promote public health.
Right now, at this very moment, we have officers in uniform who are serving in clinical jobs. They're seeing patients, whether it's dentistry patients, medical patients, psychiatry patients, mental health patients, in various settings. In addition, I have officers who are serving in the Department of Defense, specifically within the mental health initiative that's dealing with troops coming back both from Afghanistan and Iraq. We also have officers at this very minute who are serving overseas in positions in Africa, positions in Asia, who are monitoring diseases. They're looking at what's out there in order to ultimately help us here in the United States from having these diseases come to us.
While the overall federal response to Hurricane Katrina came under a lot of criticism, the PHS Commissioned Corps' role was generally praised as a prime example of how things should work. They not only provided emergency medical services to victims, they worked to prevent the spread of potentially deadly diseases.
When Hurricane Katrina hit in 2005, I think that all of us were initially shocked and then immediately went into action. The Commissioned Corps deployed almost 3,000 officers in the aftermath of Hurricane Katrina, and we were involved in a number of things. We set up and staffed a field hospital. We provided respite care. We provided care to the first responders. But mainly we were there to help the people of Louisiana who were so heavily impacted by Hurricane Katrina.
Public health is a matter of national security. The Public Health Service Commissioned Corps is the greatest defender of our nation's health and safety.
The fact is that in everyday life, behind the scenes, almost invisibly, the United States Public Health Service Commissioned Corps contributes to the health, safety, and security of the United States in many ways. We do it through our agencies like CDC, HRSA, SAMHSA, and NIH, and we also do it directly, supporting our military, working in embassies around the world, and working in some of the most remote locations around the world, including the Indian Health Service in the United States. So in short, we're a better nation, we're a stronger nation, we're a healthier nation because we have the United States Public Health Service Commissioned Corps.
The PHS employs the best and the brightest medical professionals who endure a rigorous screening process before they are commissioned. But in addition to the Corps' anonymity, there are other obstacles in the way of recruiting new members.
People can help the Commissioned Corps by learning about us, supporting us, and we actually encourage people to join us as well. Whether you're a nurse, physician, environmental science person, we are all public health officials, and we're always looking for people to come and join us to support our ranks so that you can be involved in helping to ensure the public's health as well.
The PHS Commissioned Officers Foundation for the Advancement of Public Health exists to support the PHS Commissioned Corps by expanding the competencies and capabilities of Corps officers through efforts such as education, program development, and research into new public health practices. You can help. Please visit our website. The PHS Commissioned Officers Foundation needs the support of public health experts and benefactors such as you, as we continue our support for the PHS Commissioned Corps in its ability to find better means of protecting this nation's most important asset, the health of its people.
Also, using the Chinese translator feature from Google, going to the Chinese government's National Health Commission, you'd be surprised how much of this information might actually have some truth mixed into it. People are saying that China is trying to play down the numbers, but looking at the information, they're still admitting that there are, in autonomous regions and municipalities, dozens of people every day that are getting infected from this seemingly airborne pathogen. They're probably hiding how bad the numbers really are. This summary from the Imperial College of London, on otherwise referred to as Report 9, details the global impact of COVID-19 and its potential consequences as a public health threat. Here is presented the results of epidemiological modeling, which has informed policymaking in the UK and other countries in recent weeks. In the introduction, it details the similarities to the 1918 influenza pandemic, the United States military flu, or the Spanish flu, as it is often referred. It goes on to detail tactics of suppression and mitigation, and details transmission models, which are being explored. As far as I can tell, this might be some of the best data, is the information from the Imperial College, which has gathered this from doctors, which are sending in information through their own social networks. Now again, this says nothing about the actual qualities of COVID-19, just some of the numbers about the information that we're hearing. On SSRN, you can get the PDF on the early transmission assessment of the novel coronavirus COVID-19. This article, written by Dr. Majmouder and Mandel from Harvard, created a reasonable formula for assessing the growth based on the data that they have so far. And it was probably this formula which caused the world to freak out, because it seems everybody wants a Great Wall with China now, as more and more human-to-human transmissions of COVID-19 are appearing outside of China, in places like Germany, Japan, and Vietnam. Japanese driver infected with virus from Wuhan tourists. Yesterday, a Japanese man with no recent travel to China has contracted COVID-19, apparently after driving tourists from Wuhan. And so, the schools have been shut down in Japan and Germany, and now the United States.
Regarding the situation with the novel coronavirus, we know many of you here in the room. We are at the UN building in Geneva. I wish to welcome everyone who is watching us live on WHO Twitter account, and would like to say to journalists who are watching us that they can ask their questions using the hashtag AskWH.
I'll take the genetic sequencing one first on the virus, and then the more existential ones after that. Remember in this that Chinese scientists probably the most rapid characterization of a novel pathogen in history, and that was shared immediately. Multiple sequences were shared immediately on global platforms, and that is what has allowed a lot of the diagnostics to be developed. The difference and the advance in sharing the virus is that the virus itself allows you to grow the virus. You're able to test in vitro drugs against the virus. You're able to do all kinds of other things when you have the virus. China has isolated that virus, and China is not against. And China is now currently working with partners to see how it can share the virus. There's no obstacle to that from the Chinese perspective. We're already working with Chinese colleagues, and I had direct discussions with the DG and ministers in China on that yesterday. There's no resistance to that happening. We do, though, commend our colleagues, particularly in Australia.
So it's interesting that they were able to isolate the virus so quickly, because the kind of technology it takes to isolate a virus like that, Twist Biosciences, variant models, oligopools, and genome compiler technology, along with the recent coronavirus pandemic, has led to a rapid response from viral researchers and therapeutic communities around the world. These research teams need robust, reliable genomic tools to classify and characterize viral samples. and genome engineering tools to build vaccines to stop spreading this deadly disease, says Twist Bioscience. Twist's unique silicon-based DNA writing platform allows for the rapid development of NGS panels for the viral detection and characterization of samples, and our cloned genes and gene fragments allow for quick development of subunit vaccines from one or more antigen-presenting viral genes, antigen-presenting viral genes or peptide sequences, which bypasses the need for scientists to handle live and potentially dangerous pathogens and minimize the time needed to clone DNA fragments. In a sense, Twist produces virtual DNA emulators, DNA of viruses and of humans, and of the human core exome. They even produce custom panels. And they do this using a sort of silicon photonics, which can actually read and write chemical explosions into expressions of ribonucleic acid. Irony of the Kung Flu might very well be this Duran article: liberal globalized order is collapsing under pressure from coronavirus. Coronavirus allows Trump to further push isolationism. After the US president's decision to cancel flights between Europe and the United States, with the exception of the United Kingdom, and to impose a 14-day quarantine before entry can be made, was an unpleasant surprise for Europe as Washington announced the decision without warning and coordination. The restriction has been introduced for an initial period of 30 days and is caused by the coronavirus pandemic declared by the U.S. Health Organization. Although Europe found the action to be excessive, the European Union completely failed in dealing with the coronavirus, and such actions are fully in line with measures taken by many countries, including Israel and Australia. In Israel, everyone who arrives from abroad must do a 2-week quarantine at home, with authorities not allowing hotel stays. Effectively, there is no tourism. Although Australia has imposed a 14-day quarantine on new arrivals to the country, hotel stays are allowed. Because of this, the increasing number of movement restrictions introduced by many countries due to the coronaviruses are seriously affecting both national economies and the very idea of globalism itself. Along with the US, Israel, and Australia, Russia also decided to end flights with Italy, Germany, France, and Spain, with a few exceptions. Some other countries have tightened their visa regime, such as India, Thailand, and Sri Lanka, with that list likely to expand. As the coronavirus gets out of control in some European Union countries, many Ukrainians are returning home, which could see an outbreak in their country that already has a strained healthcare system. International and national meetings and events are being canceled, including perhaps the most important, the World Trade Organization Ministerial Conference, which was supposed to take place in Kazakhstan. The World Figure Skating Championships is no longer being held in Canada, and the U.S. are refusing to host the World Cup stages in skiing. Although the World Trade Organization cancellation is the biggest event to be victim of the coronavirus later this year, the Tokyo Summer Olympics are to be held, with the torch ceremony being just days ago in Greece. The fate of the Tokyo Olympics is not yet determined, which would be a devastating loss considering it's the world's biggest event of the year. It appears that globalization is dying as coronavirus fear spreads across the globe. The idea of an open and globalized world was a core value of the liberal world, and any opposition to this was stigmatized as being a brutal regime, up until a few weeks ago, especially when we consider how the liberal world viewed the Soviet Union and views North Korea. The liberal idea of freedom of movement is almost universally accepted, and this is extended with those who travel or seek work abroad. However, such a worldview and the habits formed on its basis are beginning to cease to exist as people are suffering serious financial losses and are subject to state sanctions, such as quarantine. This is happening in various countries, regardless of their place in democratic and free ratings. And as Europe is being ravaged by and Italy's healthcare system is in a state of almost complete and total collapse, in crisis. Anything on the verge of collapse is in crisis. Simultaneously, another canceled world event, Europe's biggest ever war games, which had intended, amongst practicing of the jets, rockets, and tanks, 20 exercises which included COVID-19. Veterans Today has this article breaking today. United States brought COVID-19 to China with fake army team for military games, and evidence is mounting. In October 2019, the United States military brought 172, perhaps 369 military athletes to Wuhan for the World Military Games. Despite having the largest military in the world tenfold, the U.S. came 35th behind nations like Iran, Finland, and Slovenia. No video or photo exists of the United States team. No records were kept. A huge team, but a pitiful performance for the best military in the world. The United States team did so badly that they were called the soy sauce soldiers by the Chinese. In fact, many never participated in any event and stayed near the Hunan seafood wholesale market the entire time. The seafood market in Wuhan, where the disease is said to have originated, only days after the United States left the area. The United States team went home on October 28, 2019, within 2 weeks of the first human contact cases of COVID-19 in Wuhan. The Chinese have not been able to find patient 0 and believe he was a member of this U.S. team. They have also sources that say the United States has misrepresented influenza that Trump claimed had killed thousands. The influenza was carried to China by the U.S. team. Influenza that was really COVID-19. The disease developed in a military biowarfare facility, speculated to be in the state of Washington, now ground zero for the U.S. COVID-19 outbreak. The Chinese claim, something censored in the United States, that inattentive attitudes and disproportionately below average results of American athletes in the games indicate that they may have been in for other purposes, and they might actually be biowar operatives, and that their place of residence during their stay in Wuhan was also suspiciously close to that seafood market. When did patient 0 begin in the United States? How many people are infected? What are the names of the hospitals? It might be the U.S. Army who brought the epidemic to Wuhan. Be transparent. Make public your data. U.S. owe us an explanation. Chinese Foreign Minister spokesperson Zhao tweeted. The Chinese ministry are continually demanding that the U.S. authorities reveal what they're hiding about the origins of COVID-19. CDC Director Robert Redfield apparently admitted that the U.S. had several deaths from COVID-19 before they were able to test for it. August 2019, the U.S. Army Biohazard Lab shut down for failing safety checks. The lab in Washington State, where they had the highest occurrences of COVID-19. October 2019, Military World Games happened in Wuhan. December 2019, first COVID-19 cases announced in Wuhan. Less orthodox theories suggest malicious intent, with the head of Iran's elite Revolutionary Guard sensationally claiming last week that COVID-19 could be possibly a product of biological attack by America, which initially spread to China and then to Iran and the rest of the world. Something that seemed pretty insane last week, because there is no direct causal proof that has been established. Interesting because the few dozens of contacts identified have been monitored and isolated, yet the virus somehow began spreading anyway. To all of these countries, to even the most remote countries around the world. Even Steve Wozniak, Apple's co-founder, at one point claimed he and his wife may have been the United States patient 0 after developing a bad cough on return from China. Well, pretty soon I should do a video on virology. Again, this is just a video on data, but I thought that that would be at least an important thing to mention. And because this video is so long already, I'm going to stop. Exercise.